IV cannulation is one of the most common nursing procedures. But do you know the correct steps to perform it safely?
It is commonly used for intravenous fluids, medications, blood products, and other prescribed treatments. Before starting, prepare the required equipment: IV cannula, tourniquet, antiseptic, gloves, gauze, dressing, extension set, and prescribed IV solution. First, verify the patient's identity, prescription, allergies, and explain the brain the procedure to obtain cooperation. Perform hand hygiene thoroughly and maintain aseptic technique throughout the procedure. Apply the tourniquet above the selected site and assess the vein by inspection and gentle palpation. Clean the insertion site with an appropriate antiseptic using the recommended technique and allow it to dry completely. Open the sterile cannula carefully. Avoid touching the sterile parts. Stabilize the vein by gently stretching the skin below the insertion site. Hold the cannula with the bevel facing upward and insert it into the vein at a shallow angle. Lower the angle and advance the catheter gently into the vein. Never force the catheter. Release the tourniquet. Connect the primed extension set or IV line using a aseptic technique, according to the prescribed treatment. Secure the cannula with an appropriate sterile dressing. And ensure that the site remains visible. Check the site and infusion for complications such as pain, swelling, redness, leakage, or poor flow. Ensure the patient is comfortable and explain how to report pain, swelling, bleeding, or other unusual symptoms. Immediately dispose of the used needle and other waste according to biomedical waste management guidelines. Ensure the patient is comfortable and explain how to report pain, swelling, bleeding, or other unusual symptoms. Document the procedure, site, cannula details, date and time, patient's response, and the prescribed therapy according to facility policy. Remember, maintain asepsis, never reuse equipment, never force the cannula, monitor the site regularly, and follow your hospital's protocol. That's the basic sequence of peripheral IV cannulation. Save this video for your nursing practicals and subscribe for more nursing procedures and medical animations.